Okay, so this is the bladder right here. And we are looking at the anterolateral and the posterior surface of the bladder. Now, the urinary bladder is not really a normal type of organ because any organ that is inside our body has a fixed shape, size, location, etc. Except for the fact that the small intestinal tract and the large intestinal tract are quite movable, so we don't have a fixed location. It's the same in the case of urinary bladder because it's basically a reservoir. So we can say that it is variable in shape, size, and position. So in the location, it varies. In, for example, whenever it is not distended, because we know that the urinary bladder, of course, is filled with urine. So if it's not filled with urine, it lies in the lesser pelvic region. Now, the lesser pelvic region, so for example, if this is the abdomen, it lies somewhere here. But then whenever it extends, so for example, this is a distended it's like a normal bladder that is found inside the pelvic region. But then once it gets full of urine, it goes and it extends all the way into the abdominal region. So that's how the location varies. And also the shape varies because a, a bladder which is not really filled with urine is mostly triangular in shape when empty. So now for better understanding, let us look at the bladder and divide it into parts. The first part is known as the apex. Then we have the neck, then we have the base, and then we have the dome. Now let us look at each of these parts separately in order to get a better understanding about the relation of the urinary bladder. So the first relation is the base. Now, for urinary bladder, we know that the urogenital area of the males and females are different. So, of course, the relation of the parts of the urinary, although the urinary bladder as an organ remains constant, remains fixed in males, it's present both in males and females, but the relation is different. So, for the base, it for females it is related to the anterior vaginal wall, and for the males, it is more related to a lot of different structures like the rectum, the rectovesicular pouch. Now, this pouch is formed by the peritoneum, so keep that in mind. And then we have the seminal vesicles, the vas deferens, the denobiliaris fascia. Then we have the neck. The neck of the structure um, is also different in the case of males and females. However, as compared to the base, there are more similarities when it comes to neck as opposed to differences. So the first thing that we can notice is that the pubic symphysis and the lesser pelvis are common in female and males. So the pubic symphysis, we know that the pubic symphysis is basically the small pubic bone, and the lesser pelvis. What is the lesser pelvis? Lesser pelvis is so we know that the two pelvic bones are like butterflies. They lie adjacent to each other, and in between them there is a space. So this space is known as the lesser pelvis. So the lesser pelvis and pubic symphysis being common, the difference here is in the case of males, which is the prostate. The base of the prostate corresponds with the neck of the urinary bladder. Then we have another similarity, which is the apex of the urethra. The apex of the urethra, both in the case of males and females, is common when it's in relation with the neck of the bladder. Lastly, let us look at the apex. The apex here in males and females just have one, has a relation of the pubic symphysis. And then we have the umbilical ligament. Now, that was all about the parts of the urinary bladder. Let us look at the surfaces of the urinary bladder. So the first one that we're going to be looking at is known as the superior. Now the superior surface also, as we knew earlier, it's the one that corresponds to the dome of the urinary bladder. Then we have the two inferolateral surfaces. Then we have the anterior surfaces. Now let us take a look on the anterior surface. The anterior surface, if you sort of draw like take a lateral section and draw the urinary bladder. So that's the urinary bladder, the wall of the urinary bladder. Anterior to it, we can find the adipose tissue. And then anterior to the adipose tissue, we can find the transversalis fascia. Now remember the fact that the transversalis fascia is one of the fascia of the that lies beneath the anterior abdominal wall. So it's the fascia of the muscle of the anterior abdominal wall, transversalis muscle. So then we have, now let us look at the other surface of the urinary bladder, namely the inferolateral surfaces. Now, you can already see from here that we have two openings. Now these openings are already meant for something, and then we have other openings here too. So let us see what it is in close relation to. So it is also different here in the case of males and females. In the case of the entrances are different for both of them. So we have tubes entering, and then in the case of males, we have ligaments. So the ligaments that attach to the bladder on the inferolateral surface, in the case of males, are the puboprostatic ligaments, and then we have the pubic ligament. And in the case of females, it's just the uteric entrances. So that being said, let's look at the superior aspect. The last aspect, or the superior aspect. So there's not much to say about the superior aspect except the fact that both in the case of males and females, it is covered largely by the peritoneum. But the thing to remember here is that we know that peritoneum is basically like a sheet. And whenever a sheet folds and whenever a sheet just goes and roams around the abdominal cavity, it forms pouches and it forms structures and it forms recesses, etc., etc. So in the case of males and females, there's a formation of two different recesses due to the extension of the peritoneum. So these extensions include, for males, we have the rectovesical pouch, and it's also and this is the relation. Sigmoid colon is a relation rather than because it's a colon. Colon is like an organ in itself. However, the rectovesical pouch is the structure that is created by the folding of the peritoneum. Then we have the structure for the female, which is correspondingly just like the rectovesical. We have the vesicouterine pouch that is created by the peritoneum. The bladder is connected to the adjacent wall of the pubic bone with the help of ligaments. So these ligaments are not actually true ligaments. So let's learn about this. So we have the connection to the rectum, we have it to the pubis, we have it to the lateral pelvic side. And then we can observe the fact that the pelvic fascia is the one that is responsible for the connection to these organs. But it's a fascia, it's not a ligament. So the condensation of the pelvic fascia leads to the formation of something known as false ligaments. And these false ligaments are not only formed by the pelvic fascia, but also by the peritoneum. So the peritoneal false ligaments are anterior in nature and attach the entire structure anteriorly to the medial, and forming the medial umbilical folds, forming the median umbilical ligament or the uricus, and then we have the folds that are over the umbilical arteries found here. So this is the internal part of the bladder, and internally you can notice that there are a lot of mucosal folds. Now the other thing that we can observe is the fact that these mucosal folds they also extend downwards onto the trigone of the bladder. So that right there, this entire structure is known as a trigone. And on the anterior superior lateral ends of the trigone, we can find the uteric orifice or the ureters of the kidney. They come inside here and provide the bladder with the urine from this part. Then inferiorly we can notice there are perforations that permit the movement of prostatic fluid in the case of males, and also there is a slit anterior-inferiorly that is a urethral opening. Then we can notice the prostatic ducts, the crest for the prostatic ducts right here, and then we can also observe that the outer covering of the trigone is made up of two types of muscle. There are two layers. The first layer is known as the longitudinal muscle layer, and then we have the circular muscle layer. The supply of the bladder is mostly done by the branches of the abdominal aorta. So starting from the abdominal aorta, we have the common iliac artery. The iliac artery divides into the internal iliac artery. We also have another branch known as the external iliac artery, but we are more concerned about the internal part. Then we have the internal iliac dividing into the superior vesicular and the inferior vesicular artery. So the next thing that we can see is the venous supply. The venous drainage is carried out by the infravena cava, and the branch that drains here is a common iliac, and the internal iliac drains into the common iliac, and then we have the branches of the common iliac that drain the bladder. So branches, it's like going up. basically the branches take off the blood from the bladder. They supply the blood to the internal iliac. Then the blood goes to the common iliac, IVC, and then into the heart. Yeah, so that is the bladder right there, and that's the vesicular arteries, the superior and the inferior vesicular arteries. Superior supplying the head region, and inferior supplying the apex of the bladder. And that being said, yeah, that was all about the supply. You see, that's the internal iliac, and that's the internal iliac vein and internal iliac artery. Let's take a look at the microstructure of the bladder. The bladder is just like any other organ, but slightly different. It consists normally of the epithelium, then we have the lamina propria, and then we have the muscularis layer, and lastly the serosa. But here the mucosal layer is a bit different. So the mucosal layer is consisting of the urothelium or the epithelia. The epithelia of the urinary bladder is known as the urothelium. And at normal position, you can see at the normal size of the bladder, that means when it's not filled with urine, it abnormally it is about 4 to 7 cells thick. But then when the bladder distends, it expands and it becomes 2 to 3 cells or 1 to 2 cells thin. This small sector, the small layer, also is divided into three more layers. So the basal cells are known as the cuboidal cells. Then we have the polygonal cells that are placed above it. And lastly, we have the umbrella cells that are placed above it more. Umbrella cells have this ability to stretch, so that hence they're known as the stretching muscles, the stretching cells. And they also secrete one type of protein known as protein granules, known as the AUM protein. And this protein makes the urinary bladder more porous to urine, and also blood vessels. Then, the other layer on the top of the mucosal layer is known as the lamina propria naturally. The lamina propria is made up of connective tissues, namely the muscle connective tissue. Then we have dispersed muscle cells, smooth muscle, circular, longitudinal. Then we have nerves, we have capillaries, and then we have lymph. And then above this layer, we know that there is another layer, but before that, let us look at cagal cells. Cagal cells are found where we know that cagal cells are always present whenever there is a need for contraction, and we know that the urinary bladder contracts, so hence the cagal cells. Lastly, we can see the muscularis layer, and muscularis layer is composed of detrusor muscles. Detrusor muscles are a special kind of muscles that are arranged in a special way. So the first we have the longitudinal layer, and in between them we have the circular layer, and then it follows the longitudinal layer again. Lastly, we have the serosa at the end.